All right, now the big news in higher education this week is the decision of UCT to move towards mandatory COVID-19 vaccinations. The proposal that has been approved in principle by the university's council will mean that students and staff will only be allowed to access the campus if they've had the jab. The policy is expected to kick in next year. To discuss, we're joined by Spokesperson of the University of Cape Town, Moholola. Thank you for being with us. So what does it mean that the proposal has been approved in principle? Is this definitely going ahead or not?
Good evening and thanks for having us, and good evening to the viewers as well. What it means is that there is two things that are going to follow. The first is that the executive has been mandated by council to put in place a panel. This panel will comprise experts, legal experts, public health experts, and all the necessary expertise as may be required to look into taking forward this very significant matter. Once that panel is in place, it looks at how to operationalize the resolution of council in adopting this proposal. At the next council meeting in December, the executive will report back and indicate to council as to how then will that principle be operationalized in 2022.
Yeah. Mr. Moholola, many people will support this move, but many will also be opposed. UCT, you can argue, has either been brave or alternatively it's courting a backlash here. Did you ever think of moving more slowly, consulting with other universities, with government, consulting society more broadly and being part of a broader decision?
We looked at consultation, but at the level of the UCT community, not necessarily officially, broadly with other institutions as well as the government. Yes, talks are ongoing between the university leadership as well as the government as well as other institutions. But in terms of our own consultations, we have engaged with students, we have engaged with staff, we've had two sessions last week, just before the matter went to council. It said before two sessions, separate session for students and for staff. We've had a survey as well that indicated the level of support, and both the students and the staff, the majority of them staff, we had about 74% in favor. Students, we have about 60%. But what we want to emphasize is that it was not necessarily about the percentages, but it was about soliciting a number of views. We know from the onset that a matter such as this was always going to elicit different views. Now it is those diverse views that fed into the proposal that the executive tabled before council, and those very views as well will feed into how then the panel that is going to be set up, how it takes the matter forward.
So you're happy with a percentage of 52%. The SRC says 52% of students supported the policy. That is not a huge majority at all.
Yeah. Let me clarify. The SRC ran its own independent survey, which gave them the 52. The executive ran its own survey, which gave us close to 60%, 59, 60%. However, the important thing to emphasize for us was that the exercise was not about merely the numbers. The exercise was about getting those diverse views to the fore. One of the things that came out of that is the recognition that yes, indeed, there is a percentage of the campus community that is not, for whatever reasons, in favor of being vaccinated as a condition of either registration if you are a student or of you doing your duties as a staff member. And out of that, the panel will put in place means or mechanisms through which exceptions can be considered.
Can you tell us about those exceptions? I guess it's hard to be a teacher on campus and teach from home if everybody's on campus. And some are arguing that natural immunity should count, that's a global debate. What sort of exceptions will you have?
So the panel will look specifically at what kind of exceptions will need to be considered. When you come and say, for instance, just giving examples here, I cannot take the vaccine for health reasons because my condition will be impacted if that is the case. Or if you are not wanting to take it for religious reason, the panel will put all those guidelines in place, and those guidelines will then inform how any exceptions are being considered. What is important out of that is to recognize recognize that it is not as such a matter of all students and all staff being forced to take the vaccine. It's a matter of recognizing that we did have this section of the campus population that might not necessarily, for whatever reasons, be at ease, and those cases will be considered.
All right, thank you very much, Spokesperson of the University of Cape Town, Elijah Moholola.